Hi everyone, and welcome to Contemporary Issues in Public Health Week 7. And today we're going to be talking about sexual reproductive health. So I thought I'd start with a little bit of a definition because this topic area is huge, okay? And I want to really sort of start to look at it from that contemporary era perspective and how we define sexual and reproductive health globally now and into the future. So WHO has set out the fact that sexual and reproductive health is not just simply the absence of disease, okay? This is a very complex health issue that involves many facets of society, and working together is how we look at addressing this very complex health issue. We know that it's an essential pillar of overall health, and it's unable to be advocated without empowerment of individuals, the fact that we need to view health as a human right, and also the fact that all these outcomes are sustainable and equitable over many types and patterns and contexts of societies. We know that this health issue is incredibly complex because it overlaps health, education, health promotion, looks at violence in women in particular, but violence in general as well, socialisation. It looks at the gender roles within communities and societies, which again is incredibly diverse globally. The diverse nature of sexuality in itself as well, but in amongst cultures, and then tying in mental health issues as well. So as you can see, to actively define sexual and reproductive health into just a single definition is near impossible. It encompasses so many elements of our lives and the diverse nature of our lives, and increasing diversity within our cultures that need to be considered. When we're looking at actual health issues within that umbrella term of sexual health and reproductive health, then we're actually specifically looking at things like abortion. We're looking at adolescent care and adolescent health. We're looking at things such as cervical cancer, congenital syphilis. We're looking at contraception. Okay, so this is a big issue still for many women that are disempowered to use contraception within many countries. We're looking at female genital mutilation, infertility. We're looking at maternal and perinatal health. We're looking at sexually transmitted and reproductive tract infections, sexual health in general, which is, again, it's important to remember that sexually transmitted infections aren't necessarily the only element of sexual health we need to consider. Okay, we need to consider the mental well-being of sexual health, sexual identity and sexual diversity, as well as being sexually transmitted infections, stillbirths and violence against women. So as you can see, a very diverse range of health outcomes and health issues that we as public health practitioners really need to think about addressing. Because there's so many, and because it's such a broad topic that you can look at from global perspectives, local perspectives, today's lecture is just going to have a spotlight on sexually transmitted infections, okay? Hopefully, with the other resources and readings I've provided in this week's content, you'll start to get a gauge of some of those other aspects. I also encourage you to jump on the WHO website and have a look at maybe some other interest areas regarding sexual and reproductive health. But for this lecture today, we're going to be focusing on STIs. There really is a hidden toll of sexually transmitted infections, okay? The health burden, the disability, and the unquestionable catastrophic health outcomes of sexually transmitted diseases globally is still a big issue. Previously, and here is historically, we know that venereal disease during World War II near killed, which is a sexually transmitted disease, near killed more or disabled more armed servicemen than what was at the front line in certain stages of combat. Venereal disease caused for not only hospitals to be set up for the wounded during World War II, but also hospitals to be set up specifically dedicated to the treatment and education from public health perspective of these servicemen that were experiencing this highly contagious, highly sexually transmitted disease that was coming often from brothels and sexual workers within these camps. We're not looking historically at sexually transmitted disease. We're now looking at it in this current modern contemporary era. I want to highlight what issue it still currently is. Annually, there's 357 million new cases. So that is an extraordinary amount of new cases if we're looking at incidents of sexually STIs globally, okay? And it's particularly among those that are either entering sexual activity or within the peak of sexual activity, 15 to 49 years. We're looking at 131 million chlamydia cases, new chlamydia cases. We're looking at 78 million new gonorrhea cases. We're looking at 6 million new syphilis cases. And then we're looking at 142 new trichomonas vaginal infections as well. So if we take those infections and we think about the impact of these, it's huge, okay? So we're looking at fetal and neonatal death explicitly contributed to syphilis infections, okay? So we're looking at least 300,000 fetal and neonatal deaths each year specifically contributing to syphilis infections. Cervical cancer, huge rates of cervical cancer from the human papillomavirus or the HPV virus, which we know, or genital warts, which we know if we can prevent, we will then be able to reduce the rates of cervical cancer. There's a direct correlation between the HPV virus and outcomes in cervical cancer. Infertility. Huge amounts of infertility is caused by chronic and ongoing sexually transmitted infections such as gonorrhea and chlamydia. So if we're looking at infertility worldwide, we really need to get a handle on these new cases and this spike in the increase of these STIs to really address the infertility that we're seeing. Again, HIV risk, we've talked about this previously, but it's a sexually transmitted infection, and it also pairs with things such as syphilis, gonorrhea, herpes, all those co-inhabiting infections are also seen with HIV infection. And unquestionably, as a global health impact, it really has a catastrophic effect on not only the physical, but also the psychological and social consequences of STIs. When we're looking globally, you can see where a huge body of these new cases sits, okay? So we can see that there's a huge portion over in the Americas, North and South America. We can see within Africa. Also a huge amount around Asia and Southeast Asia, okay? So there's a lot of work to be done globally in getting or curbing these increasing rates of STIs. That was global, but we're also seeing it here in Australia as well. It still remains one of our major public health issues, and particularly in increasing rates of chlamydia within Australia, gonorrhea, again, the HPV virus, and hepatitis A, B, and C. Not only are we seeing this across Australia in general, but also we're seeing astounding rates of chlamydia diagnosed in Aboriginal and Torres Strait Islander people, and also increasing rates of syphilis within this population and gonorrhea as well. So we've already got increasing rates in the general population, and in this subpopulation we have extremely high rates, which again we need to start thinking about from a public health perspective. So just looking at this this graph on chlamydia, we can really see that over the last 5, 6, 7, 8, almost 10 years, this continual trend and this little quite a significant upwards turn for both male and female in terms of increased rates of chlamydia. So we start thinking about why this might be happening and what are some of the platforms that are we seeing this most common. So we know that this is incredibly common in young adolescents. Is this occurring because there's a lack of protection occurring in newly sexually active adolescents, Or are we opening up to more sexual partners? So is that public health messaging of using condoms and sexual health clinics not meeting the mark? Is there a turn in our sexual practices? Is there a disempowering of young women and young men to say, no, I'm not going to have sex with you if we're not going to use a condom? How do apps play into this? How do this mobile nature of our digital world, in terms of we're now interconnected in so many more ways with so many more different people than we were previously, is this increasing this rate of sexually transmitted diseases within Australia? Again, you can see quite a marked increase in the curve here in the last 10 years in gonorrhea. And again, we know that the at-risk population here particularly is young female and male adolescents and young adults, so that 15 to 25-year-old age range. What is it within these populations that we as public health professionals really need to start thinking about? Are we targeting? Is the messaging fatiguing? Are we needing to look at building confidence of young female and male in broaching these questions and discussions? Is there more sexual activity with strangers and they feel disempowered to have these conversations around prevention? Also want to take a brief look at human papillomavirus, or HPV, the unquestionable link that we've seen in the evidence showing between genital warts, or HPV, cervical cancer, and how we can then prevent that. So we know that the vaccination program, or the vaccination that's been developed in the last 15 to 20 years, specifically targeting the HPV virus and prevention of the HPV virus, can then in turn reduce those rates of cervical cancer. So we know that targeting that genital wart, that viral infection, preventing that occurring, then prevents those changes in the cervical cells and long-term that risk of cervical cancer. We also need to, from a public health perspective, continue the messaging of promoting screening. So we know that genital warts can lead to the cervical cancer. We know that intervening or our public health rollout of vaccination can reduce the rates, but it's also important to remember that we promote the need for screening in young women, particularly to pick up those abnormal cells in prevention of cervical cancer. We know that this is such an important part of the puzzle, and the fact that WHO has recently put this as a number 3 priority when looking at the global sexually transmitted infection strategy that they've put forward for the next 50 years. Okay, so they really want to emphasize on eliminating cervical cancer through the use of this HPV virus. Okay, and through that elimination of that sexually transmitted infection can then in turn reduce this burden of disease that we have within cervical cancer. Evidence always speaks louder than words, and we can see here that this is the latest rates of surveillance of HPV virus within Australia, and we can see a marked decrease when the vaccination program was implemented in 2007. So with the uptake of that vaccination program, we can still see mostly there was a little bit of a trend against it here in the 21 to 30 years, and that's accounted by the fact that this age group was the age group prior to it being mandatory within schools. Okay, so the public health policy now is that it's school children, it's part of their scheduling, their vaccination scheduling now, but it was not for this age group that was developed prior. So there's a little bit of a blip here, but then it's still starting to come down. And again, here we can see the marked reduction in cervical screening, okay, in abnormalities on cervical screening. So like I said, it's still important to have that cervical screening as a public health message, as it's still important to pick up those abnormalities, but since the vaccination was brought in, we can see a marked decrease in those abnormal cells being picked up. So we've looked at one very small piece of this huge, very complex public health topic that's got many layers globally and nationally. But in terms of Australia, what is needed? Well, we need a concrete sexual health strategy. At the moment, we don't have a national one. Each state's have one, but maybe we really need to look for an Australian national sexual health strategy to really start to control and work towards the elimination of this burden of disease. And the elimination is the ultimate goal from a public health perspective. We can eliminate these infections, then we can eliminate these burdens of disease and death, and ultimately have better health outcomes globally and less human suffering. Thank you. See you next week.